Good afternoon and welcome to our webinar this afternoon. I'm Joanna Wolf. I'm Vice President for Advancement in University Relations at UHD, and I am pleased to moderate today's second Return to Work Town Hall in preparation for our much anticipated return to campus on Monday. We know that many of you have questions about logistics and campus readiness, and we're going to do our best to answer those today through our conversation. I want to make it very clear, though, that we're presenting today about our plans for the continuation of summer 2021. We will be hosting another town hall in August that will focus on specific plans for the fall. So today we are talking about the continuation of the summer. So in an effort to keep things moving along and give plenty of time for a short presentation and Q&A, I'm going to turn it over to President Blanchard. I want to remind you that you can ask a question at any time using the Q&A button at the bottom of your screen. President Blanchard.
Thank you so much, Joanna, and thank all of you for joining us here today. This town hall precedes a very important moment for the University of Houston downtown, the full return of our faculty and staff to campus. I recognize that we began our gradual return to the university in June, but now everyone will be back, and I'll say back just in time. We're preparing for the start of an important academic year, so the full support of every staff member and every faculty member is critical as we welcome our students back to campus, or prepare to welcome our students back to campus. During my career in higher education, I have worked through some challenging situations, including devastating hurricanes and other crises. But I must say, however, that nothing can compare to the events of this past year. Although my arrival at this campus was almost 1 year to the date that classes and operations moved online, I must recognize everyone's swift action, swift response to this unprecedented and very unpredictable situation. You have performed admirably under trying conditions, and our students and our university were all much stronger because of it. While I look forward to seeing everyone back on campus, I want to ensure that we continue not only that we will work hard, but that we will also work very smart. Let's continue to make the very best decisions regarding our personal health and safety, and to not only benefit ourselves, but to benefit others in our campus community. Take advantage of the resources available here on campus. Those who have already been back on campus have likely already seen our COVID testing kiosk, which is open for all faculty, staff, students, and all Houstonians who need it. And if you were unable to attend our previous vaccination events, UHD is hosting another one on August 26th as we partner with HEB. I also encourage you to make the most of today's event. We have several members of UHD's leadership team joining us, as well as representatives from the UH System Office to answer all of your questions. So if you haven't already submitted questions in advance, please send them to our moderator using Zoom's chat function. Once again, I just want to say thank you for your work over this past year, and I look forward to seeing all of you back on campus very soon. I now would like to take the opportunity to turn the presentation over to Dr. Michelle Musali, who serves as Assistant Vice President for Planning and Curriculum. And she will present an overview of safety enhancements that have been implemented at the university in preparation for our full return, as well as provide us with some updates on campus operations. Dr. Musali.
Thank you, President Blanchard. I'm happy to be here. I'm here, I think, primarily in my role as chair of the COVID-19 task force. We have a great team of folks who are meeting weekly to talk about issues and bring information to you. And so I am here to share with you a brief slideshow, and then we really want to dedicate most of our session to questions that you might have that we have not been able to answer via that slideshow. So Obviously, we are here at a return to campus town hall conversation for everybody. We want to start with some campus enhancements. Just a reminder about what we've been doing and working really hard for on campus. So next slide, please. Oh. And then the next one, thanks. So we have done a number of things, which you've seen as you've been on campus in the past few weeks. We have the door openers installed in the bathrooms. I'm still working on how to leverage those most effectively. Hand sanitizers all over the place. We have enhanced cleaning conducted nightly in the public areas. Air filters are routinely replaced. Air handlers are being upgraded throughout campus. And we have plexiglass barriers installed throughout campus. And I think it's important to note that these are, of course, for summer, but these will also continue all the way through fall semester. So we're still trying to maintain that safe campus environment. Next slide, please. Our business services, we wanted to bring you some information about parking and transportation as well as our food services. So parking and transportation, we do have the summer permit registration link that was distributed and activated, and we are going with a 50% discount for summer. But we will revert to the pre-COVID parking permit fee structure for FY 2022. And so you have the chart. I don't know if you can read it in detail, but this will be available for all folks, and it's also available from our parking and transportation resources. So please make plans for your parking as you're thinking about returning to campus on the 12th, and then in a few weeks as we resume for fall. Next slide. Dining services. So our teams have been working really hard to try to make sure that we have resources for folks when they are coming back on the 12th. So Starbucks, Burger 713, and Gator Bite Cafe will be open Monday through Thursday. Starbucks has a little bit longer time period for openness, but you'll notice that Burger 713 and Gator Bite Cafe are open for longer periods than they had been prior to our July 12th date. Just a note that in addition to having more opening hours, we have mobile ordering available. So if you don't have the app, you can get the app, but they are also doing in-person ordering for this period because we know that that's important. A small note you'll see on there that Burger 713 is actually going to transition to fully mobile online ordering only in the fall. This is a permanent plan to enhance customer service because they do customized orders, and so they're just trying to make sure that they can get that done more efficiently. The other areas in the cafeteria will resume regular services, we believe, but that will be updated on August 4th. We also have included here a link to downtown district's resources for off-campus options. So we know that a lot of the restaurants are coming back to life down here, and if you are interested, we have a strong partnership with them, and we want to continue to support our local community as well. So we'd encourage you to check that link because it is updated by the downtown district regularly. All right, next slide. This is the Boost mobile ordering app. So if you have not downloaded it, you can find it in the auxiliary service webpage, and you can select the dining mobile ordering option on the left-hand side. This is great. Thank you for that larger screen view. So you are welcome to do this, but as we indicated, in-person ordering is going to be available starting on July 12th. Next slide, please. So thinking about additional health and safety opportunities on campus, if we could go to the next slide. We do have vaccine clinics coming up. The president mentioned one on August 26th, and we also have one on September 17th. So we continue to encourage folks to get vaccinated. You can bring your family. There are sign-up opportunities, so please do so and encourage anybody who is interested to take advantage of this resource in our partnership with HEB. Next slide. COVID testing on campus. So we do have a kiosk. It's very handy. It is free, and it is a self-administered, and I'm going to emphasize the word shallow nasal swab test. I know that there had been an understanding that it was oral. They have switched to a nasal swab, but it is shallow. There is a video. I have not watched it, but in case you're interested in knowing exactly what that entails. So you'll see that it's outside the Student Life Center. It's as often as you want to go. It is the RT-PCR test. And then notice that starting in early July, they will offer a multi-disease test for the cold and flu season as well, if you're interested. When you sign up, you have a choice to sign up through the UHD faculty staff option or through the general public option. UHD will be notified if there's a positive COVID-19 result, only for those who have given their prior consent. So just so that you're aware of that option. All right, next slide, please. Events on campus. So the events office is accepting reservations for indoor gatherings and events, as they always are. For summer, again, through our next couple of weeks, on-campus in-person events are being reviewed on a case-by-case basis, and they are prioritizing enrollment-related needs because we have a lot going on and bringing in new students. For indoor gatherings and events to be held prior to August 2nd, if you require support or reservations via the events office, we recommend that if it's over 75, you consider a hybrid or virtual format because we don't have space capacity. If you're having an in-person event prior to August 2nd, it will require the social distancing setup and all food has to be pre-packaged. However, starting on August 2nd, for events held on or after that date, and you are going through the events office, reservations, food options, and spacing will resume as per pre-COVID operations. So we're going back to full capacity and you have more options for your food choices. So just be aware that August 2nd is that kind of shift date. And so until that time, the events team may still request that you fill out the more complex social distancing setup options just to make sure that we have it on record, but they are moving toward the full-on pre-COVID options as well. Next slide, please. Workplace accommodations. So I know this is a big question. We're really aware that folks are wondering what the options are for when they're coming back and how they're coming back. We have two workplace accommodation options available to our employees, the FMLA leave and the Americans with Disabilities Act, the ADA. So for either one of those, you should check with the benefits team. For the FMLA, it's available if an employee meets the qualifying events, and we do have a policy that would help you understand what those are. The Americans with Disabilities Act is available if an employee qualifies for a reasonable accommodation under the ADA for a modification or adjustment to a job, the work environment, or the way things are done that enables a qualified individual with a disability to perform the essential job functions, right? These are all things that we have been familiar with, and certainly we would encourage you to check out the policies to see whether you might be eligible, and you can certainly contact the benefits team and ESO with any questions on that. Next slide, please. The flexible workplace policy, obviously an area of ongoing interest and engagement for all of us here at UHD. Unfortunately, at this time, UHD has not received any updated information that would allow us to implement a flexible workplace policy right now. So we continue to comply with current state law as we understand it, and we certainly would support everyone to try to seek accommodations as per the protocols, the ADA, the FMLA, and to contact ESO if you have questions about those. Additional updates, things to be aware of, as announced in President Blanchard's message, UHD is no longer requiring social distancing anywhere on campus, so you will see the signage removed when you return on July 12th. And staff will be back on campus with pre-COVID schedules on July 12th unless there's an ADA or FMLA accommodation per ESO. This is what I know we are looking forward to, having kind of the full return, although we've all been here working for the past few weeks as well. So that's where we are with our kind of activities and things that are going on. We do want to remind you of the executive orders that we are operating under, which is helping us determine what actions we can and cannot take on campus. So Executive Order number 35 prohibits UHD and other state agencies in Texas from conditioning receipt of services on an individual's COVID-19 vaccination status, and prohibits us from requiring employees to show proof of vaccination and reveal private health information. Executive Order number 36 is, of course, related to the fact that we can no longer mandate the wearing of face coverings in any campus spaces or at university-sponsored events. However, we do want to emphasize that folks are welcome to continue to wear face coverings if they wish to. This is something that we want to respect and recognize across campus going forward. We do encourage people who are not fully vaccinated to continue to wear face coverings in public settings where they would be around other people to protect themselves and others who are not fully vaccinated. And we also strongly encourage students, faculty, and staff to get vaccinated. We have these great options coming up, and so we hope that you'll be able to take advantage of that. In general, we just have a couple of FAQs here. We just want to remind everybody about what those executive orders entail for what we can and cannot ask. So we understand that there is a concern about whether the university can require a COVID-19 vaccine. We cannot require this because it has been approved only on an emergency basis, and it cannot be required, and we are also related to that governor's order. As a supervisor, are you allowed to ask who has had the COVID-19 vaccine? No. We are not allowed to ask whether any employee has had the vaccine. So same thing applies if you want to know if your coworkers or students are vaccinated. Can or should you ask? Unfortunately, no. You should not ask for personal health information from coworkers or students. We want to make sure that we are complying fully with those governor's orders. And so you would only know about coworkers or students or an employee if they voluntarily share that information with you. Can we require or invite only vaccinated employees to attend in-person meetings? No, you cannot limit in-person meetings to those that are vaccinated, again, because we cannot request or know that information unless it's voluntarily shared. Next slide. Do I need to wear a face covering and practice social distancing on campus if I receive the vaccine? Again, per governor's orders, face coverings and/or masks are no longer required at UHD. So for those who prefer to wear the face coverings and masks, they can certainly do so. We strongly encourage unvaccinated people to wear the face coverings, and we encourage people to get vaccinated. Do we still have to observe social distancing on campus? We are no longer requiring social distancing anywhere on campus, but we do encourage you to pay attention to your safety and practice personal accountability as you safeguard your own well-being. I think that brings us to the end of the formal presentation, and now is the time that we want to spend talking with you all about what your questions are. So I'm going to turn it back over to VP Wolf to guide that conversation.
Okay, so now is the time we're going to answer some of your questions. We have questions that were submitted when you registered for today's event, and I know there are well over 300 of you on here today. So there are a number of those questions that we will begin with. But if you have questions throughout, please use the Q&A function on the bottom of your screen. I'm going to start by asking all of the panelists to just introduce themselves. So if all of you could turn your microphones on and your cameras, and I will begin with Cynthia Vargas.
Hey everybody, my name is Cynthia Vargas. I'm the emergency manager here on campus.
I know you've met Michelle Musali already, and you've met Dr. Blanchard. Karen Livingston.
Good afternoon, I'm Karen Livingston, and I am the interim AVP for finance.
Thank you. Daniel.
Hi, my name is Daniel Villanueva, and I serve as the Vice President for Enrollment Management.
Akif Dean Usman.
Hi, I'm Akif Usman. I'm the interim dean. You did that, Joanna. I'm the interim provost and also professor in natural sciences.
Thank you. Sorry about that, Provost Usman. Yvonne Montalbano.
Good afternoon, everybody. Yvonne Montalbano, Vice President for Employment Services and Operations.
Jennifer Bloom.
I am Jennifer Bloom. I'm a Senior Assistant General Counsel.
Okay, and I think we have Tim Reichlich.
Hi, I'm Tim Reichlich. I'm the Associate Vice President of Facilities Management here at the university.
And Mary Torres.
Good afternoon. I'm Mary Torres, Director of University Business Services.
Okay, I think that covered everybody. So let me start with this question for Yvonne Montalbano. Can non-student facing offices continue a remote schedule after July the 12th?
No, all staff are asked to follow their pre-COVID on-campus schedules.
Okay. And also for you, what is the status of the faculty staff home office stipend?
So when the proposal for a home office stipend came to the university leadership, we consulted with the System Office of General Counsel, and based on their response, we were unable to approve such stipend. And it was based on two reasons. First of all, we cannot use CARES Act to pay employees for a home office stipend as it could be challenged by the U.S. Department of Education. Also, we cannot pay employees retroactively. So providing a stipend for work performed from home with a home office back to March 2020 could violate the state's constitution.
Thank you. And I know we've answered this question, but just to reinforce it, can staff continue to work remotely?
No, again, all staff are being asked to follow their pre-COVID on-campus schedules.
Very well, thank you. Dr. Musali, if students do not feel comfortable returning to campus but need to take a class that is face-to-face, is there an alternative?
Hi all, sorry, I know my video isn't up. But I think that certainly the pandemic has caused a lot of our students and faculty and staff indeed to think about what it means to have personal health and safety on campus and what that might mean for their classes. If students have concerns about being on campus, they should consult disability services to determine if there might be an accommodation that would be viable if it's based on a disability. But if an accommodation is not warranted, we would encourage students to really think about what class modality is best for them and talk to an advisor and or a department chair about options and when the course might be offered again if they need to take it.
Okay, and will there be options for online classes in the fall, or will everything be face-to-face?
We will certainly have online options in the fall. We have a large number of online offerings and hybrid offerings as well as in-person courses.
Thank you. This is also for you. Will faculty host in-person office hours for students, or will those be by Zoom?
Great question. We don't have a university-wide specific requirement about how faculty offer their office hours, but they are required to identify specific hours each week that they're available to students. So choices of modality often correlate with the type of class that they're offering, whether they're teaching in person or online. They can certainly hold synchronous office hours online for students or a combination of in-person and synchronous.
Thank you. Daniel, how will a student get their ID?
So currently students can go to our sports rec facility and get a picture there. Typically that's something that would be done at Gator Gateway in person, but because those were previously scheduled virtually and still remain scheduled virtually, they may not get them while they're attending Gator Gateway. However, there are a couple of on-campus experiences for orientation that the orientation and transition team have planned, one starting next week, and then there are a couple of others throughout the months of July and August that allow students, new students, to come on campus to get their schedules, to get a copy of their ID, as well as search for the location of their classes, receive t-shirts and other items as that.
Great, thank you. And Provost Usman, will the student activities area on the second floor be open and available for use?
Actually, I don't have information about that. We're online for the summer student-facing services but Daniel is informing me right now, thank you, Daniel, that it will be open. But students should be aware that a lot of other classes and faculty offices may not be freely available unless they make an appointment with the faculty beforehand.
Thank you. Cynthia, the question here is, if someone feels uncomfortable, can they still continue to wear a mask?
Absolutely. So while the university isn't mandating mask use, we certainly encourage anybody that's not fully vaccinated or anybody that feels more comfortable wearing a mask to use one. I'm currently not using one, but I'm going to be honest with you, I'll probably start wearing one in September just because I don't like catching colds, and I'll start exercising that. You'll probably see me walking around with a mask next semester just out of personal preference. Right now, it's not really cold season, so I've chosen not to.
Right. And can you tell us a little bit, what will the protocols be if someone tests positive for COVID after we return?
Yeah, so it's no different than what we've been doing up until now. People have been doing a really great job reporting their diagnoses, especially anybody that's been on campus. So basically, if you've been diagnosed with COVID, report that diagnosis through the COVID diagnosis form. That information goes to our contact tracing group. They're going to contact you and provide you information and support. They're going to help you figure out what your best return to work or return to campus date is. We want you to communicate with your doctor, follow their protocols or their recommendations so that you can manage your symptoms. And And once you meet the CDC guidelines for discontinuing isolation, which is basically being fever-free for 24 hours and allowing a minimum of 10 days to have passed since those symptoms or that positive test came up, then at that point, we want you to submit a request to return to campus. That alerts us that you're feeling great. We're going to reach out to you again to make sure that, that you're ready to come back. And if you have any questions, you're always free to contact me or any of the contact tracers on campus. You can use the UHD COVID-19 at uhd.edu email address for very specific questions to your situation.
Thank you. And can you talk a little bit about the classroom safety protocol? And especially talk a little bit about social distancing in the classrooms as well.
Sure. So currently we don't have, for the summer classes are online. But once we come back for the fall, we're going to come back to our pre-COVID occupancy rates. So, a lot of the seats are going to be occupied. Now, besides COVID, we have other emergencies that we are very aware of and prepared for here on campus. So those safety protocols are actually posted at the front of your classroom near the entrance. It's kind of where the phone is. And you'll see it. They've got basic instructions for things like fire, hazardous materials, hostile intruder, evacuations. And these are like the top 5 or 6 things that we want you to do in order to stay safe. Those protocols are also available on our website. As far as COVID-related incidents, so if there is someone suddenly becomes ill while they're in class, or they suddenly discover that they're positive and they were sitting in class, something to that extent, there are very specific protocols that the professors have. It's at the front podium. And we've got step-by-step, again, it's like 5 or 6 steps with how to get everybody out of there, how to evacuate that room, how to send folks home, and who to contact. And it's basically a one-stop shop. So staff members can look at that. It's literally plastered to that desk, so it's not going anywhere. But anybody can walk up there and see it. Specifically, it's send everybody home. We want you to fill out the appropriate forms so that we're notified in emergency management. We want that professor to tell us the time, the date of the class, so we can get that place cleaned up immediately. Well, and the process really starts to grow. We wind up notifying the registrar's office. We may need to reschedule other classes somewhere else. But all those processes are already written down and delineated and accessible to the right folks. Tim's group from facilities is going to come in right away. We're going to get that place cleaned up. And after that, or simultaneously, because all this happens pretty quickly, the contact tracing group will actively reach out to the members of that class to figure out who, when, and where we need to get you quarantined, isolated, or whether you are allowed to come back if you've been fully vaccinated. One of the things that we ask everybody is to continue performing your daily health checks. Before coming to campus, go ahead and do that daily self-assessment. Do you have that sore throat? Do you have a headache? Are you just not feeling well? If that's the case, please don't come to campus. Let folks know you're not feeling well. Stay home and go get tested, or contact your doctor. Find out if that's allergies. Don't just assume it is. Check it out a little bit more thoroughly than you normally would. And again, if you start not feeling well, throw that mask on right away and get off campus as soon as you can, so that we really can box in this virus. We've been doing a great job so far. We haven't seen any massive outbreaks on campus, and we're going to continue to work together in order to make that just a signature part of UHD.
Thank you. I have a couple of questions for Mary Torres around parking. Can you tell us if where staff or faculty can purchase a parking pass?
Sure. Thanks, Joanna. You can select your parking pass through our parking portal that's located on our UHD Parking and Transportation Services website. Once you're on our website, you select Manage My Accounts, and you'll be prompted to provide your UHD credentials. At that point, you can select Get Permits and just follow the screens into it.
Great, thank you. And is there a parking option for faculty who will be teaching hybrid courses in the fall?
Unfortunately, at this time, we do not have a parking permit option for faculty teaching hybrid courses. Our parking system only receives employee classification information from PeopleSoft payroll module. For example, faculty versus adjuncts, staff versus part-time staff. And it does not track faculty teaching loads, but we are reaching out to our PeopleSoft programmers to gauge the feasibility of extracting the faculty data from our CS module of PeopleSoft into our parking management. But at this time, it's unknown if we can accomplish this prior to our FY22 parking permit registration period that will start early August. So we're continuing to work on that as well.
Okay, and then a final question, will the shuttle run this summer for employees parking in remote lots?
Unfortunately, with the minimal face-to-face instruction provided on campus this summer, it just was not cost-effective to run a shuttle bus.
Okay, thank you. I'm going to switch over to the Q&A questions now and ask some of these. Let's see. Tim, I believe this question probably is best either for you or Cynthia. How will computer labs be managed and kept clean?
Currently, they're clean like any other facility right now. If there's a class or anything that's in them, we ensure that they're cleaned every night. We're using the EPA and CDC approved cleaning agents to ensure that the COVID SARS is killed by use of this. And in the case of the computer classrooms, if they're a lab that's open to everyone, they're cleaned every night.
Thank you. I'm going to address this question to either the provost probably, or perhaps Dr. Blanchard. Are faculty coming back to campus on July the 12th?
Oh, I unmuted first, so I'll go first. We are online for this second long summer session. And so as online faculty are expected to come to campus for whatever departmental functions or college or university functions that are required of them. Otherwise, they will conduct themselves as they would with any online course. And so the expectations are what we'd expect prior to COVID in terms of teaching an online course, which means they would be expected to come to campus if called upon by the university or the department.
Thank you. Jennifer Bloom, can I ask you to answer a question regarding the flexible work policy? Could you talk to us about what the status of that is? There's some questions regarding other state institutions that may already be permitting that, and so what the status is for the UH system.
So that's a great question. And I saw in the Q&A about the MD Anderson policy, and I'm not familiar with that policy. And their designation of certain job categories that would be potentially full-time remote positions. It's my understanding that the system had made inquiry and asked for an opinion or feedback from the Attorney General's office in terms of how a flexible workplace policy would how it could be consistent with the government code that sets the dates and the work hours and workplace for state employees. And as of today, there has not been a definitive answer in that regard. So we're still in the same holding pattern that we were, I believe, at the last town hall.
Okay, thank you. See, Cynthia, I believe that this question perhaps is for you. Why is social distancing no longer required? The questioner notes that the vaccination rate is not yet what we are aiming for, and that the Delta variant is now spreading. Do executive orders address social distancing?
So I'll tackle the first part. One of the big moves was, or things that we were waiting for, is for both therapeutics and vaccines to be widely available. They are. At this point, it really is a matter of choice whether you get vaccinated or not. There is a small percentage of folks that, per their doctor's orders, are asked not to get vaccinated. Those folks, again, it's a very small group. So for the majority of us, we have our resources. In addition to that, we have the ability to mask up. We have the ability to continue to sanitize and clean. The rates of here locally have really gone down. So we're actually in a pretty good spot. But we continue to watch. We recognize that COVID's not over, that we're still in a pandemic. We just happen to be in a good place right now. So we're going to continue to watch that. We're going to follow best practices and continue to communicate with local health professionals. And if the need ever arises, we'll collectively come as a group and decide whether UHD needs to shift again in order to ensure the safety of the community.
Thank you. Can students ask each other if they have been vaccinated? I guess Yvonne, do you want to answer that question? Or, okay, Akit.
Yeah, I'll chime in. I noticed that, and it's a faculty member asking the question. So I want to address the fact that there are two pieces. Students can talk to each other about whatever they want. However, as a faculty member, we are state employees and we are bound by the spirit as well as the letter of the governor's executive orders. So I think we would not encourage students to ask each other personal questions within the public space. And so the governor and the state of Texas regard this as a personal question. So I would not find myself, I would ask you to not find yourself in a position to be asking for allowing personal questions like that to be asked in the classroom. You can't control what happens outside the classroom, but you can control what happens inside the classroom.
Thank you. Cynthia, with summer travels, will a coworker who has gone out of town be asked to quarantine before returning to work? And actually, I'm going to ask Yvonne to answer this question. Sorry. With summer travels, will a coworker who has gone out of town or out of the country need to quarantine before they return to the office?
Yes, they will. And Cynthia's office will monitor that, but they will be asked to quarantine.
For out of town and out of country?
Out of the country.
Out of the country. Okay, thank you. I just wanted to clarify that.
A little bit to that answer. So we follow CDC guidance on this. And right now what the guidance is that persons that are fully vaccinated, persons who have received the last dose of their series and 2 weeks have gone by are considered fully vaccinated. So folks that travel internationally and return to the US, if they do not have symptoms, we don't ask them to quarantine. If we ask them to monitor for symptoms or monitor for any kind of manifestation, but they're not required to quarantine. Now, folks that are not fully vaccinated, if they're partially vaccinated or unvaccinated, those folks are required to quarantine for 10 days.
Thank you.
Thanks for clarifying that, Cynthia.
No problem.
Is it permissible to request a colleague or student to step back at least 6 feet? And is the request different, is the answer different if it's in their office or in a public space? Cynthia, sorry, you're sitting there, so I'm going to ask you again. You're in the hot seat.
You know, as an organization, as an institution, we are not enforcing social distancing. So at a professional level, the answer is no. If you're uncomfortable with that distance, then it should be actually go the other way. You should step back if you would like space. And that's not just COVID. I mean, that's just life in general, right? If someone is standing too close to you, and we all have different distances of comfort. I personally don't like people standing 1 foot away from me. I really like that 5 foot to 5.5 foot cushion. And so you'll see me naturally just step back, whether we're inside, outside. It's just I like more personal space. Now you can politely ask a friend to give you a little more space, but this isn't something that as an institution or as bosses we would require somebody to do, of having this permanent 6-foot bubble of safety around us. It's, it really has become more of a personal choice and personal responsibility. It's no longer something that the organization is going to enforce. So really, it's a matter of being kind to one another, being courteous to one another. If I note that somebody is uncomfortable with me standing close to them, whether it's COVID or otherwise, I would naturally give that person a little bit more space.
Thank you. Tim, I have a couple of questions for you here. One is about elevators in the parking garage at the main building, and the other is about doors. So let's start with the elevators. Is there a reason that the elevators are not operating in the parking garage at the main building? It is not accessible for staff who can only access parking on the second floor.
It should be operational. What sometimes happens is when the police shift between evening and day, they sometimes don't turn off the security feature. I'll make sure that's taken care of and that it's deactivated every morning at 6:30.
Great, thank you. And then there's another question. Will someone see that all doors to campus will be open in the mornings at pre-COVID times? Currently, there are still several that remain locked.
Yeah, they're on a timer right now, and some of them open at 8, some of them open at 7, but we'll make sure they're all moved to about the 6:30 time frame. That way, if people get in early, they could always get through a door.
Great, thank you. Yvonne, does anyone know if UHD benefits from CARES Act funds pertaining to FMLA extension through 9/2021?
I'm not sure what the question is, because their FMLA is in place. It is an unpaid leave, but employees can use sick leave or vacation leave. So CARES Act funds cannot be used towards FMLA though. So again, I'm not sure what the employee is actually asking.
Okay. Let's see. I'd like to encourage that the questions really should be about the return to campus. And I see some coming through here that I'm not sure we have the right people on the panel to answer the questions. So we're going to skip through some of these. Yvonne, and I'm going to start, well, I'm going to answer this question and then others actually may want to step in. There's a question about, since we have been doing remote work for the past 15 months and that if there's a weather event, would we revert to remote work as opposed to closing campus? And I think the answer to that is really, it just depends on the situation. It very much depends on what the weather emergency is. There are some times where, we lose power in portions of the city, where streets are widely flooded in one area and not in the other. So I think that's the decision on that is going to need to be made on a case-by-case basis. Yvonne and Cynthia, do you have anything you'd want to add to that?
Well, we typically, like you said, if there is a flooding all over the city, employees cannot get to campus, then we may close the campus but allow employees to work remotely. However, if there is no power throughout the city, then we would close the university and we would grant weather emergency leave to all employees.
So it very much depends on the situation related to that particular emergency.
Yes.
Daniel, since there are 2 to 3 cohorts of students who have potentially never been on campus, are there any special efforts being made for those students in terms of acclimating them to the university?
Yeah, there are, for all new incoming freshmen, there are 4 on-campus experience opportunities, one starting next week, and then another one in later July and 2 in August for all new students. In addition, we will have a freshman convocation. We're exploring topics today about possibly inviting last year's freshman class, as well as possibly expanding it to transfer students. So there will be opportunities as we transition into the start of fall for new students who haven't been a part of UHD previously to acclimate to the campus, either through the orientation on-campus experiences or the new convocation.
Thank you. Yvonne and Cynthia, if someone tests positive, will they be required to be off work? If so, for how many days? And will they be compensated or use sick leave for that time?
So if somebody tests positive, they have to quarantine. And if they can work remotely, then they don't have to take sick leave. Otherwise, if they're sick and cannot work, then they have to use paid leave, paid accrued leave. So if they don't have sick leave, then vacation.
Thank you.
So Yvonne, just a clarifying question, if their work cannot be done remotely, but yet they feel okay, but yet they need to be quarantined, they still have to take personal time, is that correct?
That is correct.
Let's see here. So Cynthia, what happens if we learn voluntarily a student has contracted COVID? What will the protocols be for faculty to follow? And then there was also a request that some of those protocols be provided to faculty in advance of the fall semester. Cynthia?
I apologize. I just realized I was muted. Yeah, no, great suggestion on providing it in advance. I'll work directly with Dr. Musali to make sure that that information gets out to you all, some detailed information. So as far as learning about a person, I would ask that you strongly encourage that student to report it. There are some of your students are going to be hybrid students. They may not have been on campus recently, and so they may not have impacted those classrooms. Some of those students may have been coming to campus recently, and they may have been in places other than your classroom. So there may be multiple locations that we want to clean up, and they may have exposed multiple folks. So it really is important that you encourage your students to report it as soon as possible, so that we can work with that student and with their peers in order to ensure everybody's safety. But a lot of this is an honor system. And so it really is incumbent upon us as leaders, as supervisors, as staff members, and as faculty members to really communicate the importance of that reporting process. We're only going to use it for the efforts of contact tracing and to keep other folks safe. We're not going to disclose that student's name. We're going to be very private about how we run our questioning, and we may actually play it a little safe and quarantine a few more folks than we need to, so that we can safeguard that person's identity. So again, just have them report it. Again, we've been having classes on campus in some capacity for over a year now. And these aren't the first cases. We've had several scares, if you will, or several reports of this. We've already tried the methods and the process, and it works. So please just communicate that to us. I will get more information to you, more detailed information, so that you can have a checklist for faculty members in addition to what is already there on the desks.
Thank you. Yvonne, I believe I'm gonna ask perhaps for you to answer this question. The individual indicates that they have been on campus and have seen or been in a position where they were asked whether or not they had been vaccinated. If an employee or staff member of any sort is asked about their vaccination status, is there some step they should take?
I'm so sorry. Would you repeat the question? I was typing an answer and missed half of it.
So if someone is on campus, a staff member, and they are asked by another staff member about their vaccination status, what should that person do?
They can decline to comment.
Thank you. I know there have been some questions regarding returning equipment to IT, And Hossein Zarwoki is not on this call, but I did text and ask him about that. He indicated that much of the equipment that has been loaned out is equipment that is used in computer labs or in classrooms. And that's one reason that they're asking that equipment be returned. However, if you have equipment that you need at home, then IT is certainly willing and able to work with you, and you just need to make that request. A student is asking, is there a requirement to come on campus if your degree will be completed online?
No, there's no requirement, although we certainly would enjoy you participating in some of our on-campus events and hope to see you at the graduation when you complete your degree. But there's no standard requirement for a student to attend if they can complete all their coursework online.
Thank you. Yvonne, there are questions regarding our ability to work, let's see, during pre-COVID times when there was a weather emergency, we never worked from home. The university just closed. If we are going back to pre-COVID ways, then why would we be required to work from home as opposed to just closing the university? And I think that once again, it depends on the weather situation and the ability to do the work at home or to be able to come into the office. Cynthia, is there any number or percentage of positive COVID reports that will trigger a shutdown or work from home request from the university?
No, it's not a specific number. It's really situational, and it's really a totality of the circumstances. To trigger that type of shutdown, it's not it's a decision that takes, it's a complicated decision, and it takes a lot of folks weighing in for something like that. My expectation is that cabinet, Dr. Blanchard, would meet with other healthcare providers. They would get input from system. They would get input from other leaders here on campus to determine whether the situation is unstable and warrants that. An individual number doesn't really give us an indication of the level of risk. So think of it this way: if everybody is clustered in one small space and it's contained there may not need to be a reason to shut down the university. Whereas if you have a very widespread appearance, right, of related cases, that may be a little bit different. So again, it's a case-by-case decision.
Okay, thank you. All right, someone has asked regarding being asked about your vaccine status. The question is, if your supervisor asks you about your vaccine status, then what should that employee do?
I'll be glad to take that one. Great question. So again, you do not have to disclose your vaccination status. And if your supervisor is asking that question, your supervisor is not supposed to be asking that question. You can report to ESO. You can send me an email and just say, I've been asked for my vaccination status, and we'll remind the supervisor not to ask those personal questions of employees.
Thank you. How do we handle requests to attend in-person events when we are not comfortable gathering in large groups with people or who may or may not be vaccinated, since we cannot ask? I'll take a first attempt at that. I think that for the near future, many of the larger events and gatherings, you'll be able to choose whether it's by Zoom or face-to-face for large gatherings in the auditorium, et cetera, things like that. Does anybody else want to take that question? I mean,
I can attempt it. I think that, as the university migrates back to being fully operational pre-COVID on July 12th, there will be more and more meetings that may require faculty and staff to be in person with the Zoom option available, I think. But as we phase more and more, I don't know that will always be an option. I do know that there are several meetings in enrollment management that have become very, very fairly large, upwards of 40 to 50 people, at which we could never meet in person pre-COVID or post-COVID, that may remain on Zoom because it works for us. But I do think there might be some meetings, and we all have to use our personal judgment and wearing masks and socially distance from others if we have that concern, as we're requested to meet in person.
Thank you. Cynthia, this question is for you. Is the UHD dashboard showing the total number of COVID cases? Does that include students?
It does. It includes students, staff, faculty members, and contractors, folks that work here on a regular basis, but may not be UHD specific employees. So yes.
Do we have a reliable statistic or percentage of students and faculty who are vaccinated?
No.
No, we're unable to ask, so we do not have that percentage. This question, what about on holidays such as Thanksgiving, students and faculty travel, would they need to quarantine?
As it is right now, and again, folks, this CDC's guidance evolves, right? And as they evolve, we move to evolve with best practices and the latest lessons learned. As of right now, the guidance is that vaccinated persons who are exposed to COVID that do not show symptoms do not need to quarantine. Persons that are not fully vaccinated or are unvaccinated, if they are exposed to somebody with COVID, a known COVID case, or if they are showing symptoms, they will likely need to quarantine or isolate. Again, it's case by case, so it's really important that they reach out to report the incidents through the reporting form so we can get the appropriate contact tracer to speak to them for their very specific situation. The mere act of traveling within the US typically does not elicit the need to quarantine. However, there have been states that have imposed some quarantine rules. Definitely, if you go internationally, there's some other issues that arise there. So again, if you're vaccinated, no. If you're not, we need to help you discuss that and explore that so that we can help you quarantine if you need to and select the appropriate return to campus or return to work date.
Thank you. And Cynthia, I want to come back to the question again about wearing masks on campus. That is available at any time, at any point, to anyone on campus to wear a mask. The university is considered a mask-friendly environment. We anticipate no, and really tolerate no dismissiveness of individuals who choose to wear a mask.
That's correct. I mean, you're going to see me wearing them on and off throughout the year, throughout the school year, to be honest with you. Just based on my own personal decisions and evaluation of risk. The expectation here is that the campus will be very supportive, tolerant. We encourage anybody that wants to wear a mask to wear it. So while we won't discriminate against those that don't wear one, we certainly aren't going to discriminate against those that do wear one. So it is a very tolerant environment, whether you choose to wear a mask or choose not to. And the individual person may choose to change their habits depending on what's going on in their specific life or situation.
Thank you. Dr. Blanchard, I saw you nodding. Did you want to speak to that question as well regarding wearing a mask on campus?
I couldn't agree more with the response that Cynthia provided, that we want to make sure that people feel completely free to wear a mask. Just as Cynthia noted, I can say for myself that I'm fully vaccinated and that I wear masks at some points during certain meetings and outings here on campus, and there are times when I don't. And it's just my personal choice, but I'll continue to do the same thing. There will be times when I will have a mask on and there'll be times when I won't. And so that's the kind of judgment that we would expect, that certainly for those who are vaccinated, that's the kind of judgment that we would expect that would be exercised. And obviously, if someone isn't vaccinated, then we would hope that they would elect to wear a mask the entire time that they're here.
Thank you. Daniel, question here. Where is the best place to point students so that they can understand the differences between face-to-face, hybrid, asynchronous, and live online classes?
So there is a webpage that the provost office has had up, and I'm not certain that it's still up, but the Keep on Teaching website did have some explanations to it. It may or not may not be up, but Shannon Cunningham, who's our director of academic scheduling and our new social media person, is working on some videos and some social media graphics that we'll be posting that help explain the difference, not only in the delivery of the instruction, but also how to search and how to recognize the differences of those classes in PeopleSoft. So I would, I don't have an estimated due date, but we certainly have heard from a number of students who are looking for those differences in PeopleSoft. So we are working on those. Those are on our list of things to do, and certainly hope to have those done by the beginning of August.
Thank you. Mary, there are some questions about mobile ordering and whether or not the restaurants will be fully up to speed and able to handle that in the fall.
Yes, ma'am. We will have Chick-fil-A will reopen. We will be launching our new Mondo's sub sandwich shop, salad bar. We're looking into the logistics and reopening that, being it that's a self-serve food venue. Burger 713 will continue to be open, as well as Starbucks.
Okay, thank you.
I just want to ask the question here because I know that the question really centered on mobile app for that one. I think that's what I heard you say. But that there would be opportunities as well for people to just place orders as they go to these different restaurants here on campus. Correct, Mary?
For fall or for summer, beginning
For
next
fall,
week?
for fall, that's right. I keep forgetting that this is actually for the summer and not the fall. Yeah, but by the fall semester is what I was thinking of, that they would be able to order directly and not necessarily have to use the mobile app.
The Burger 713, because that is a customized food venue where you're customizing your order, we are pushing to have that mobile ordering only, just to assist with the congestion down there once the fall starts and we do have more students on campus, more traffic. Chick-fil-A will not allow us to do mobile ordering just because they want their food to be made and served quickly, and it's a grab and go. The students have, or the customers have, a limited menu option, so they're grabbing sandwiches, nuggets, fries, and they're gone. Whereas Burger 713, it's a little more of a customized, you're placing your order. Yes, sir.
Okay, thank you for that.
Okay, there's a question regarding remote work during emergency situations and some frustration regarding whether or not the question's being fully understood or answered. The question is that university faculty and staff did not work remotely pre-COVID during weather emergencies. So why is it that that is allowed by the state now when a flexible work schedule is not?
So they make a very good point, and this is something that we have not addressed. In fact, I've made a note here to raise that question with cabinet, because again, like they've pointed out, pre-COVID, if there was a weather emergency, if there was a situation where people could not get to campus, we would close the campus, we would grant emergency leave, and that was the end of it. Nobody had to work from home. But during COVID, because most people were working remotely, if there was an emergency, well, it was a moot point. And for those that were on campus, working from campus, then they were asked to work remotely. So we'll need to revisit that, and we'll send something out in the next week or so to clarify our position as an institution.
Thank you. There's a question here regarding, well, an additional question about whether or not we're allowed to ask individuals if they are vaccinated. And I think we've covered that. There's a question regarding UHD COVID cases indicating the number of positive cases on campus. That is on our website. Cynthia, do you want to address that?
I don't, is it one of the last questions?
Yes. Uh-huh.
Hmm.
It looks like the UHD COVID site has not had a link. It may be someone just answered it because the question just disappeared.
Look.
Okay. I know that there are some questions that we perhaps did not get to today. So I just want to remind everyone that the COVID email site, coronavirus@uhd.edu, coronavirus@uhd.edu is still open. If you have questions and you want to submit them there, then we will be working on getting those answers to you. In addition, we will be continuing to update the FAQ. So you can look there for additional answers to some of the questions. And I want to turn it over to President Blanchard, who may have a few comments to make before we sign off today.
Well, I just want to say that I certainly hope that everyone who participated here today found this session to be helpful. We are really working aggressively to ensure that we're able to not only answer all of the questions that you have, that creates a sense of mental relief in knowing before you get here what to expect, but also we're working very diligently to follow all of the health and safety protocols that we possibly can in order to make sure that when you do return, that it is going to be an environment where you will feel very safe and know that we're following all of the different guidelines. And so I just want to say, continue to ask questions. As Joanna mentioned earlier, we will have another town hall meeting that will be coming up in the fall semester. That one will be more specific to the fall. But all of this is really leading up to the fall semester. And I know that, while the summer isn't here, even the question that was raised about, can faculty come to campus? And obviously, if there's a need for you to come to your office or to engage in a meeting, you certainly can feel free to come to the university. And starting certainly July 12th, that flexibility is open for you to do that. But you're not being required, especially if your courses are taught online, to actually be here to teach those respective courses. But all in all, I just want to say that everyone's been giving a whole lot of thought to this. I've been here since March 15th. This has been such a priority area for us, as it is for just about every university within the United States, because we want to make sure that we're striking it right. And that I know that as the leader of this campus, that giving the appropriate care to everyone, and including the health care, really matters tremendously. And so I just want to say thank you so much to all of the panelists for all of the work that you do daily, in not only for COVID and COVID preparation, but you do daily for quality and excellence in our overall operations. And Joanna, I just want to end by saying thank you very much for facilitating this conversation today that I found to be very valuable and helpful.
Thank you very much. And thank you to everyone who joined us today. And we will see many of you next week. Bye-bye.